My name is Himanshu Shukla. I'm a cardiologist. I grew up in New York originally. I did my residency training at Columbia University, and I did my electrophysiology training, which is a subspecialty of cardiology that deals with heart rhythm disorders. I trained at University of Oklahoma. My training at University of Oklahoma was with a fairly prominent electrophysiologist who's credited with a lot of advancements in the field of heart rhythm management, and he was responsible for developing a lot of the tools that we use today for curative procedures for these types of ailments. The field of arrhythmia management is a subspecialty again of cardiology, and I have chosen that particular field primarily because it's not only one of the emerging fields in cardiology, but it's also a very technical field in cardiology. So there's a lot of technological advancements, a lot of tools that we're able to use, and the benefit of this field is that it truly offers very curative procedures for patients. The best way of really describing how our approach, the overall practice's approach to treating new patients and our philosophy for any one of our patients is really to try and individualize their care. So we try not to pigeonhole the patient based on the disease process, but we try to offer different tools and different options that may be available for patients to try and customize those tools for their disease process. What we try and attempt to do is to be able to use our different treatment options that we may have for patients and try to allow them to see what is the best way of choosing those options to be able to treat them as an individual. I'm a big proponent of going back to how we take care of a lot of pediatric patients, where we have well child checkups. I think the same philosophy should be maintained for adults, in that they should be periodically assessed for known risk factors to be able to modulate those risk factors earlier on before they take a toll on the overall system and there are additional, more catastrophic medical problems that have to be dealt with. I think that the most important thing is to be able to find a relationship with their physician, to be able to have open dialogue, open communication, and to be able to have enough trust, both directions, for both the physician and the patient, that we are able to meet the treatments for their individual needs.